So my dad does not need any more medications. For the first time in 20 years, he's gone through a year of no medications, and that is, to me, an amazing thing. And all I can think about is why couldn't this have been done sooner? When he was 40, I'm sure he could have easily knocked off this disease now that we've seen that he does not require medication to control his blood sugar.
Hi Adrian, thank you for joining us today.
Thank you, Dr. Manveer.
Alright, so Adrian is a carer for his father who has had diabetes. And just tell us a little bit about your father's relationship with diabetes.
So my father has had diabetes for over 20 years. And prior to that, he had been steadily gaining weight. He was pre-diabetic as well. He has been treated by endocrinologists and a battery of different specialists for various complications arising from his diabetes. And all this time he has been, following the regimen of pills and prescriptions that they've given him. But his weight ballooned over the 20 years. He was quite obese even just last year. And this had led to complications in his health. It had affected his walking. We as a family had no idea just how bad it had become until he had a fall, and it was found that his legs were unable to support him. And at that point we realized that his relationship with diabetes had become too much for him to manage.
I see. Okay, Adrian, what was the turning point for you and for your family in terms of his diabetes control?
As a family, we had all become quite aware that my father was going through issues with his health once he had this fall. But it became a turning point in my life and in his life when I came back one day after speaking to you, Dr. Manveer, and realizing that he was at the table with all these pills. He had these boxes of pills that had been put in front of him, and he was preparing for the week's worth of treatment. And that's when I asked myself, how is it that after 20 years, no one has been able to successfully treat his diabetes? And because of the information that I had gotten from you, I suddenly started to believe that, yes, there must be a better way. There must be something that can be done about this. Unfortunately, I didn't act fast enough. And he developed a blister on his leg, which became infected, which is quite common for diabetics. They get diabetic wounds. The blister itself wasn't such a huge issue, but he did not get the right treatment for it. And subsequently, we went to specialists, orthopedic specialists rather. And after 3 or 4 weeks of antibiotic treatments, the specialist called my mother and myself into the room with him and said to us both that you may need to be prepared for an amputation because we've just done a surgery. That surgery was to remove the infection, and unfortunately it's not been successful. So when I was sitting there, I asked him, what do you mean by an amputation? Is it going to be are you going to amputate a toe? And he said, no, it looks like due to the complications of diabetes and the cardiovascular issues that your father has, it's unlikely that if we amputate a toe where this blister was, that it would actually heal the infection. To stop it from becoming worse, we'll have to take it off at the knee. And this was a very gut-wrenching moment for both my mother and myself, because the thought of my father not walking, that became just unbearable. And when we spoke about it as a family, at first my father thought that, this can't be real. It can't be that it's gotten this far. And we were quite certain that it had gotten so far that this was actually being considered by a doctor nonetheless. It's not just somebody coming and telling us this needs to be done. It's a specialist who's probably seen thousands of cases like this. So it was at that point that as a family, we all decided that whatever happens, we're not going down that path. We're going to figure out a way somehow to get my father back to good health. We ended up going to see another specialist who did another surgery, which was successful. It managed to stop the majority of the infection. He went on antibiotics. And it was at that time that I came to you, Dr. Manveer, and we all decided to see what can be done about my dad's diet, what can be done about his weight.
As to your dad's food, How fast did you see the difference once he had made the lifestyle changes? How quickly did you see a big drastic difference in terms of healing?
It's a very, very pertinent question because we have conclusive, we have a conclusive idea of the difference between when my dad was taking care of his blood sugar and before, because the wounds that he has sustained, he underwent 2 surgeries, as I mentioned. The first surgery, it took him 4 months without any intervention, still taking medication, still using his old regime. And it took him 4 months for healing of that wound, for it to close. Subsequently, for the second, because the infection had not been totally overcome, the second surgery that was done, same wound, it left almost half of his foot totally open. The flesh was stripped to the bone actually. That same wound, after going through the treatment, the most stringent version of your treatment, his wound healed in 2 months.
Wow.
And all the doctors that we had spoken to, our primary caregiver, the orthopedic surgeon who was treating the case at that point, even his endocrinologist, they were all so surprised that a wound like this could firstly heal so quickly. And none of them could understand how he had managed to bring his blood sugar under control, because before this they had all been trying to convince him, and he had never done that. Absolutely. There's no doubt in my mind that there's been a huge difference, not just to his blood sugar and his diabetic control, but to his overall body weight and to the way he carries himself now. Because not only is he more aware of what he eats, he has the ability to exercise more self-control in the choices of food that he takes. And this has all come because of the realization that he can eat his way to health, which was something that he had never realized before. He had been doing the total opposite. He had been doing what he thought was the function of the medicine, which is that he should continue to eat the diet that he had that had got him into the diabetic place to begin with, while using the medication to counter the effects. So for the past 6 months, he started going on the food control and minimal exercise at that point because of his injuries. And he had dropped his weight from close to 100 kgs to about 85 kgs, and now he's about 83 kgs at this point in time. And that was a huge difference.
Fantastic.
Yeah, amazing difference. As for his HbA1c, so prior to this year, he was averaging around 13, 14, if I'm not mistaken. But after the first 3 months, and in the second 3 months that we've seen, he has gone down to 5.6, which is, as far as I know, equivalent to any normal person on the street who does not have diabetes.
And all this without medication?
No medications at all.
Just food control?
Just food control. He has been off medications now. It's August already. It's almost 4 months that he's been totally off medications.
Fantastic. So I'd like to ask you, from your perspective, how hard was it for your father, especially him being such a big foodie, to make that transition from high carb, sweet food, the standard Malaysian diet, to going low carb, completely restricting from high sugary foods? It must have been a challenge not only for him, but for you as a carer to encourage him as well. So just describe to us that journey.
So firstly, I would like it to be known that my father is a very disciplined man in all other areas of his life, except for food. And I believe that this is the main reason why interventions like this are always going to be challenging. And it was for him. It was very challenging at the beginning because this was where he allowed himself more leeway in life. And suddenly he couldn't eat all the sweet foods. In fact, like when he was told no carbohydrates for 3 months, it was a very difficult task initially. Thankfully, myself, my mom, we were spending time with him, and whenever we had meals with him, we were quite strict about whether he was going to follow the diet or not, because we were doing it with him. At that point in time, we were both, whenever we could be with him and eating with him, we would follow his diet. That helped a lot. But the major change that occurred was after about 2 months, and he started to see the results, especially because he had been sending you the WhatsApp messages of what he was eating for the day and then checking it against his blood sugar. When he started to see that there was a direct relationship between what he was eating and what his blood sugar reading was going to be, and it started to sink in that he had control over this, it didn't require much more intervention from us as a family. He started to take not just the initiative to make sure he was eating right, but I believe he started to take pride in the fact that he was making a change to his life. And that change was very visible. So it was breaking past this barrier of thinking that diabetes is untreatable, that the only way to handle it is with medication. Once he saw that he could literally eat the right food and get the right result, it made a huge difference to his own journey in overcoming this.
All right, from a carer's perspective, what do you think the biggest change you notice in your dad?
There's a lot of changes. He's a lot calmer. One thing that diabetes had taken away from him was his self-control. There were times where he would get stressed, especially when he was going through the wounds, the treatments and all this. He would get very stressed, And when he was craving, for instance, carbs or sweets in the first 2 months, there was a single time where I actually had to have a fight with him. We had a verbal altercation over the fact that he wanted to eat rice. And I told him, look, this is not going to do anything for you. And I believe at that moment, when he realized it for himself, that his mood was being affected by the fact that he was craving carbs, that was the major change in his life, because it became clear to him at what points was he losing control of himself, losing focus of himself. And it was very clear that this was tied to what he was eating, and what he was craving. So it was a big change for him once he realized this. This is the major change that I've seen.
I see. So I think for him being such an intellect, and he would require a lot of data, and being presented with the data, the blood tests before and during the program itself, do you think that was one of the things that helped him stick by the program, or was it something else? Do you think? What do you think was the breakthrough that he had personally from switching and sticking to this and going through the program and seeing it through?
The breakthrough for him, I believe, came when he realized he could do it. That was very clear. And as you mentioned, data was a very big part of this. He had never gone through a period of time in his life where he took careful measurements of his weight, of his blood sugar levels, and at the level that you were asking for every day after every meal. He had never become cognizant of exactly how he was consuming food. And so he had never realized the connection between what he was eating and the way he was feeling and the way he was physically looking, how he was actually carrying himself. And this was a huge change for him, to be paying attention so closely. So in a way, the data helped him convince himself. But the turning point, I think, in his mind was the realization that it's not that hard. After a certain amount of time, he was able to carry it on his own. The good thing for us as caregivers is that after about 3 months, he didn't need any advice from us. He was very happy to send you the messages on his own. There was a point in time where he would slack off on the messages, I remember, and we would tell him, no, you have to, or he would, and I'm not going to besmirch his name, but there were times where he would omit certain sugary treats that he would have added in, but we told him, just send it to him. And then one day, the change came where he was like, I just had this, bowl of rice along with my curry, and I was like, just send it to Manvir, just let him see what you're doing. Because the more important thing here is that you're not just accountable, but you realize the difference between what you're eating and the blood sugar that you have. Don't get a wrong idea about it. A lot of people don't understand how difficult it is growing up with a father figure or a role model who is not physically fit. I was very physically fit throughout my life, up till my early 20s, I would say. But it was always because I was looking at my dad and saying, like, I can't be like him, I can't be like him, I can't be like him. And it didn't give me much respect for my own body, because I'm constantly in a battle between what should be and what shouldn't be. So I had to make up my own rules, and I lost that battle plenty of times, because it's sometimes easier just to go back to the pattern that you've seen. And going through this process with him, for me, has been tremendous, because just as he has discovered that he can take control of his body and fix it, it has become absolutely clear to me that that's what I should be doing too. I have the privilege of being able to see my dad do something that's, to many people, quite impossible. To me, before seeing this, you can think about it rationally, and you can intellectually, you can know that these transformations happen. But once you go through something like it on your own, so to cut a long story short, my brother, myself, we set up a gym at home, and we started working out with my dad, because we realized that we are not going to go into a period of our lives where we're going to spend 20 years overweight with diabetes or heart disease or anything like this. We know now that it gets that bad. It gets that bad. Why go down that road? So the major contribution that he has done for us, and that we are all trying to learn and accept, from me, myself in particular, is just putting this issue behind us once and for all, as a family, for me as an individual. Just finding out what is the right way to eat, what's the right way to live, and how to exercise and be fit in our own bodies, and to keep it going, because there's no need to go back to this.
Finally, what would be your message to the people out there, especially diabetics, who are seeking to make the change in lifestyle?
I would say two things. First, to anybody who's seeking help on this issue, accept the help. Like, accept it from whoever it is that supports you. Accept it from your doctors. Accept it from the people that are doing their best to help you to change, because this is something that's going to put you against everything that you've known before. For diabetics, I would say this is not something that you need to do alone. You can always get help on it. It's important enough that you should accept the help that you get, especially if it's heading you into a direction where you'll be free to be yourself, to no longer depend on medications, to no longer require any assistance from anyone, just to be normal. Accept the help from the close friends and family that you have, the caregivers who are willing to give their time to you. Accept the help from your doctors. Keep in your mind that there is a final outcome here, and that outcome is clear. The outcome is when you are healthy and you don't need to worry about your blood sugar anymore. You don't need to worry about what you're going to eat tomorrow or the day after, or whether you're going to suffer some sort of attack because of it. So accept the help. And can I add, for caregivers as well?
Yeah.
Anyone who wants to give care, this is not something that is difficult to do, but it's not something that's easy either, because it does require your time. And it requires you to be, at times, the person who puts a stop to whatever the bad habit is. Whether it's having an extra bowl of rice, or in my case, 2 extra idlis. Having the right kind of food in front of that person sometimes may mean that you are the one who's going to go and get that food, because they are not going to be able to make the decision clearly on their own. Then they'll just break their streak, or they will do something that they're going to regret. The win is not just on eating the right food, it's on having the right feeling about doing it. Because eventually, as a caregiver, you're going to have to let this person go on their own. You can't be there all the time. And they need to come to a sort of personal accountability. And what I feel as a caregiver you can do is that you can be the person to give them that example of what accountability looks like. And after that time, they'll be okay on their own. When the doctor left, we all sat down, and she had just told us anywhere between 4 and 7 for the day is manageable, we'll manage. And we asked my dad, is this what you've been doing for the past 20 years? Have you been managing your diabetes? So he didn't get off his medications immediately, as you know. He started the diet first. But the major change had occurred when he had finally heard a doctor tell him, look, you can overcome this, and we're going to get you off your medications in the process.
All right. Just to add on, at any point of the 20 years of your father having diabetes, was there a clear emphasis on weight loss and sugar control, where there was a massive focus, a very narrow focus, that you had to lose X amount of kilograms? Was there a regimen? Was there a program that you required to go through? Do you think there is a gap in the current system, in our healthcare system, where we need to have something like this?
Absolutely. Don't get me wrong. I had asked my dad the same question. Like, I asked him, like, has anybody told you you can eat well and you can exercise and you'll get better? And he knew. They told him from time to time, but no one had told him that that's the one thing you must do if you want to get better. And I remember hearing from a friend in the US. My dad was with me at the time. And when my friend found out about my dad being in the hospital, he told us both. He told us, in the US, if you get diabetes, you can't claim your insurance on it unless you go through a lifestyle change. And you have to prove to your doctor that you are eating better and you are exercising. So at that point in time, in that hospital, we were just our minds just opened up. We just suddenly realized, like, look, they have been saying this the whole time, but nobody had ever made it the point. The medications were not supposed to have been going on for 20 years. It was meant to be that stopgap measure until he fixes his lifestyle. But nobody had done that. None of the doctors he had been to, none of the specialists. I would say they were quite happy to keep prescribing medication to him because he could handle it at that point in time. It was only when his leg was about to be chopped off that everybody started getting a bit more worried about things. But it didn't stop anyone from saying that you need to get your body in check.
Do you think there's an over-reliance on medication and prescription, where we Malaysians tend to put an emphasis on getting treatment but not getting the help we actually need ourselves? Do you think there's a perception that I just need to be on my medications and not do much else apart from that?
Yeah. I mean, I've been to dinners with my parents' friends where all of them are diabetic. My father's good friend from childhood, both of them are diabetic. They used to have a bet that they would lose weight together and so on. I'm friends with his son, who's a doctor in Melbourne. And his son is going through the same problem I'm going through. Because both these guys, when they eat, they make jokes about things like, oh yeah, I've got this medication to solve that problem, and I've got this for the blood sugar, and I've got this for the, the hypertension, so I can eat whatever I want. That attitude, I personally believe, is not being overcome by the health system in Malaysia. The doctors are not doing their level best to get it clearly into their patients' heads that medication is not the answer. I think it's an omission rather than an act of commission, but it's an omission that is costing a lot of time to families. When I say costing time, I mean they're going to lose their lives early, and their families are going to lose a lot of time with them, and it's costing their ability to enjoy the quality of life that they actually can have. Because if the healthcare system does not educate that medication is not the solution, where are we going to get that answer from? If we believe as lay people that medication is the solution, then for me the major realization was just seeing the fact that he doesn't need medication now. And it's been 20 years and this is the first year of his life where he's not using medication. So are you telling me that this couldn't have been done earlier? This is how I feel about it. When he was in his 40s, I'm sure this could have been done then.